All right. I know I'd sent you guys an email earlier or a message on Canvas or however that comes to you. Tonight is kind of an important part of before you can start your clinical and field stuff. I have to go through orientation. If you know, I'd send the email if you went through it in Des Moines, because I know Cheryl covered it in her class, I think last week or the week before, then you necessarily don't need to sit through this one. It is kind of important information in regards to who to contact, how to schedule time, how to set up clinicals, how to document stuff in Platinum in regards to field shifts, clinical shifts, and even scenarios when we start getting into more of our scenario time. Are you guys able to hear me okay? Or is there any issues?
You're good.
I can hear you just fine.
Okay. All right, so if you have any questions during, please, this is going to be the time to ask them. This is being recorded, so I'll make sure to get this posted as well. I will probably post it in 113 and 114, EMS 113 and 114. 113, anything that ends in a 3 is your clinicals, anything that ends in a 4 is your field time. So second semester would be like 134 for field, third semester would be 164 for field, and then 133 and 163 for your corresponding clinical. So what we're going to do tonight is go through our handbook. And again, if you have questions when we start to go over it, I'll show you how to access your handbook, how to get to some of the pertinent information you need to get to. And then towards the end, what we're going to do is show you guys how to document in Platinum and what is expected for clinicals versus field time, as well as scenarios. So ask away if you have questions, more of a Q&A, and then kind of showing you guys around. So again, we'll go ahead and get going here. So when you get into Canvas, which is where you're going to find your courses, where you take your exams, all that sort of thing. 114 again is your field, 113 is your clinical. They both have the same information in them as far as evaluations and handbook. So I'll just select 113. If I just scroll down on the main page just a little bit, you're going to see our evaluations, which we'll go over here shortly. That you have to have filled out for your clinical and your field time. But what we're going to be focusing on tonight is that EMS clinical handbook. I'm going to zoom it out a little bit just so you guys can see a little bit more. This handbook covers your clinical experience and your field experience. What is expected of you as a student? I'm not going to read this word for word, so I'm going to kind of summarize each section because there is a lot of information to be obtained. And I'll probably spend a little bit more time on what is the requirements expected of you during clinical and field time in regards to professionalism and your skills, competencies, and assessments, as well as your hours. Obviously, I'm your instructor, but I'm also the clinical and field coordinator. So what that means is for all ride time, I have to schedule it. You just request the ride time through me. I'll get to that here shortly. But also for any issues with clinical sites or to set up a clinical site, you would also contact me as well, and I would handle that. And then Cheryl is obviously my boss. Table of contents, if you need to quick flip to something, it's going to give you, where everything's at, whether it be the professional standards, whether it be, if you need to cancel a clinical, page 9, your behavior on page 11, or let's see, entering stuff in Platinum, as well as documentation. You can find that all in your table of contents and then just easily flip to that page within the clinical handbook itself. So when you act as a student under Mercy College, you are basically following up under our insurance policy, and you have to act as a student through the Iowa Department of Public Health, since that's what you are registered as. Now, what we were doing with our competencies when we were checking you guys off on competencies and everything like that was just basic entry level knowledge to begin your clinical and field time. That's why we had to have you document it in Platinum. Now, our goal is to make you competent, such as a competency, right? Anytime we refer to competency, it's referring to you have knowledge of something, you know how to do something. Right now as EMTs, you're competent, your competencies are in, basic life support. So when you learn a new skill, or when we were going in for innovations or something like that, it is a formative skill because you were learning as you were going. So anytime you hear the words competency versus formative, what I'm referring to is the knowledge you have versus the knowledge that you're learning. Obviously, being a student, we do hold you to a certain standard. Me also being a graduate of Mercy College, a paramedic student myself, it's very important that you maintain a level of professionalism, because every shift is really a job interview. For those of you that, you know, are looking for employment or looking to get on a fire department somewhere, maybe a larger department or whatever it might be, this very much is an everyday job interview when you're going to these. Anytime that you are documenting anything in Platinum, any patient information, you know, anything saying you were at a clinical, that please, for the love of God, make sure that is all true. Because if for some instance we find out that it was falsified, or that you made up a patient, or that you said you were somewhere when you weren't, technically you can be kicked out of the program for that. And it has happened in the past. It's unfortunate, but it's the standard that we uphold. And it kind of falls back to that ethics and morals of the job that we do. If for some reason you are sent home from a clinical or a field site, I expect you to get a hold of me right away and just explain to me what happened. It could be you were sick, you were maybe your preceptor and you weren't getting along. There's a whole bunch of different reasons. It's not saying you're in trouble. I just need to know the facts of the case before I can figure out what's going on and hear, you know, both sides of the story. Obviously following all PPE precautions. Now, I believe hospitals now, at least in Des Moines Metro, aren't mandating masks. You know, 2 years ago, everybody had to wear an N95 mask. So our precautions fall to whatever the site that you are performing as a student as. That's the precautions that you then have to abide by. Anytime you are dealing with family or the patients themselves, we do still fall under HIPAA. Everything is confidential. Acting as a student, you are still bound to HIPAA. You still have to maintain that level of privacy that is expected by the patient and the patient's family. If for some reason the patient's family or the patient ask you questions that they should be asking their physician or nurse or paramedic or something like that, you need to refer those questions to them. Don't try to answer questions that you don't know the answer to. And if it pertains to their condition or, you know, a procedure, I would let your preceptor answer those questions. Nothing should be put on social media, especially when you're doing clinical and field time. I'm not saying you're gonna have downtime during field sites or whatever it is, and you want to scroll through, that's your own thing. I'm not there to watch you. But do not post any pictures. Do not be posting any patient information. There was a student that one time took a harmless picture of, I can't remember what it was, but in the background of the picture was patient information, and it ended up getting them kicked out of the program. The problem is that it doesn't just stop there. It then went to the Iowa Department of Public Health, and they had a disciplinary action put against them. So be mindful of what you're doing. All decisions don't fall to me, they would fall to Cheryl. And if it is something severe enough, then she does have to get the Iowa Department of Public Health involved at some point. There is a phone number listed here as well on the front page, and that is what we call the clinical resource phone. That is a phone that either me or Cheryl carry, whether we're in the office or at home. So if there's an emergency or you need to cancel a clinical or something has come up, you can call that number or you can text that number. Now, if it's in the middle of the night or you're going to a clinical at 6 in and you call that at 5, you're probably gonna get a voicemail. If you call at 2, 3 in the morning, you're probably gonna get a voicemail. So if it's early morning hours, it's fine. You can send a text message to it. There's no big deal. I'm a little bit quicker at that than Cheryl is. I carry the phone majority of the time. Also, if there's an emergency of some sort, or you've had some sort of exposure or something happened outside the norm, you can contact me at that phone or send me a text message. Don't abuse that phone number, please. So to start clinical and field rotations, many of you should be at this point. Obviously, you should have a passing score. You need to complete this clinical and field orientation. You need to make sure that your CASA branch is completed, as well as your mandatory reporter, which is part of CASA branch. Skills competencies and clinical competencies, which we have been doing in Skills Lab, also have to be assessed. Then at that point, you will get what's called a red card. And a red card indicates the skills and assessments that you can perform as an entry-level paramedic. In case your preceptor asks what things you guys are allowed to do, it is outlined on that red card. When you are ready to schedule clinicals, it's going to be different for each group because I have many people on here. Most of the people on here aren't from the Des Moines Metro. So if you're going to a hospital that is not Mercy downtown or Mercy West in Des Moines, you would have to schedule your clinicals through me. I have the sites, I have tons of sites set up. I've recently set up a whole bunch that people had asked for. That entails basically giving me a 2-week lead time to allow scheduling of this. So if you want to ride, or if you want to be in the ER December 1st, I needed at least 2 weeks notice before the 1st to get that scheduled. That gives me time to get it sent off to them, and it also gives them time to reply to me and to let you know that that was approved. You just let me know the site, the date, and the times that you are wanting to perform clinical time there. If it is Mercy in Des Moines, then that is self-scheduled through Platinum, which I will go through here shortly. But if I schedule it, I will also assign it to you in Platinum, and I'll show you where you can find that. To everybody, if you are checked off in Castle Branch, you are allowed to sign up for clinicals, and you'll see them if you go to like your available opportunities on Platinum. If you are not, then I have not cleared you on Platinum to do that yet. So you won't be able to sign up for anything. And again, there's only a handful of you that are going to be doing clinical time here in Des Moines. And if you are, great, it'll be, you can sign up for your own clinicals, but if you're not, it's not a big deal. You contact me and I set those up for you. And if you want to send me 5 or 6 dates in a row, that's perfectly fine. You want to send me a month in a row, that's fine as well. It's just completely up to you how you want to do it. Now, when it comes to field shifts, if you're riding somewhere that is not your department, I cannot pick stations. A good example is Des Moines Fire. If you want to ride with Des Moines Fire, I can't say they want to ride with Des Moines Fire Station 4. They pick the station. I cannot, I can't specify that because a station might be doing training that day, or it might have to shift you around if something happens. We are not allowed to pick which stations. Now, if it's your own service and they're fine with that, then that's a different story. If for some reason you are able to perform skills or ride as a student while you're working, which is allowed, I would just need a chief or an officer or something on your department to send me some sort of verification, or Cheryl, that can happen. But outlined in the Iowa code, you have to be an extra part of the crew. You cannot be, a 2-person ambulance and show up and act as a paramedic student. You have to be a non-vital part of the crew. Now, can you perform skills if there's only 2 of you? I'd prefer not, but technically, yeah, you can, but the patients aren't going to count. Only the skills would count. And a good example of this, if say I'm riding with, I happen to be able to go on a call with my department. It's during shift change, I hung over, I went on this call. I would then email me and say, hey, I was able to run a call. Is there any way you can create me a shift for that? What'll happen is I will create you a 1-hour shift, and that's where you will document your patient information as well as your skills. If for some reason you have to cancel or reschedule a clinical shift, you can do that on Platinum through just request to cancel. I ask that you do it, give me plenty of heads up if possible, just so I can let the site know. If it is a sick call or you've had something come up, then send me a text message or call me at that clinical phone number. I would remember that, or put it in your phone or whatever it might be, because that's the number if something unexpected happens that you can reach us at, or leave a voicemail. If you don't get me right away, it's not a big deal. Leave a voicemail or shoot me a text message. I will still be able to figure out what's going on and get in contact with you at that point. Please do not no call, no show. If for some reason you've no called or no showed, there's only 2 occurrences allowed before you're dismissed from the program. Under certain circumstances, you get in a car accident and your phone's broken. That's understandable. That's not going to count as an occurrence. An occurrence would be you purposefully just not showing up or forgetting to set your alarm. That can't happen more than twice, because the clinical sites start to get a little upset with us at that point. In regards to sick days, I wouldn't say there's, this says 10 absences for the entire program. I wouldn't say that's concrete. It really just, it's taken case by case, especially in COVID kind of taught us that when people were in a 2-week quarantine, we can't really mandate that you only get 10 occurrences. But again, it's taken case by case. If you call in sick for 2 weeks in a row with a different excuse every day, then that's something I'm gonna have to address at that point. But you have to have surgery, your child's sick or something like that, something comes up, there absolutely we take it case by case. You will see all the requirements are broken down per semester. Now, is that saying you have to get those completed per semester? No. You are graded off the completion, but I've never failed anybody that was actively working towards their goal. So a good example is you have to hit 25 competencies this first semester in clinical or field. Now, a competency could be a skill, it could be an assessment, it could be an age group. So if I have a 37-year-old male complaining of abdominal pain and I start an IV on him, that's 5 competencies. The age, the abdominal pain, that's an abdominal assessment, it's a medical complaint, and you start an IV. So that would technically count as many competencies that are required, and I'll go through those here shortly. Now, if for some reason you need to get an extension, which if all your stuff isn't completed by the end of the semester, I will send you paperwork that I have to call an extension. That doesn't mean you're failing, it just means I'm extending the time for you to complete those requirements. It's not a big deal, I have to do it every year. Now, showing up to your clinical and field time. Very much like a job interview, just don't wear a suit, EMS pants, and a Mercy polo. Now, if it gets cold out, absolutely, you can have a sweatshirt or something on. It can't be anything provocative, it can't be anything profane, it has to have your green shirt on underneath it, as well as your badge somewhere. I didn't keep my badge on my waist just because I didn't want to lose it, I didn't want to knock it off. If I was going on a call or I was in the back of the ambulance, I'd put it on my shirt just so it could be seen clearly to identify me as a student. You do need to make sure that you are identifiable as a student, and you need to make sure to express that to the patient as well. If you want to wear a long sleeve shirt under your green polo, that's fine. I just ask that it's black or white. If you have any provocative tattoos, I have tattoos. I just ask that those potentially be covered, but if it's not provocative or anything like that, it doesn't bother us at all. Please do not show up smelling like alcohol, smelling like smoke. Don't show up looking disheveled like you just got out of bed. Be presentable when you're showing up to these clinical and field shifts, because they will report back to me if they think that something was being done unprofessionally. Very much like going to work, we just ask that you show up maybe 10 minutes, 5 minutes early. I'm not even saying 15. If you want to show up 10 minutes early, that's fine, 5 minutes early. With everything that you need to complete that clinical time. It could be your drug cards, it could be your computer, or what maybe you're documenting on your phone or iPad or something like that. I would just explain to your preceptor that we do our documentation online so they don't think you're surfing the web or that you're doing studying online. Just make sure that that is known to them. If that site does require that you bring an N95 mask, then obviously bring a mask with you. And if so, let me know and I can get you guys a mask. You are not just acting as a billboard for us at the college, but also for yourself and the organization that is putting you through paramedic school. So please be professional in everything you do. I would, at least if you can get your hand on a pair of safety glasses, if not, I can get them. I would probably bring those with you every shift, just so you have them, so there's no exposure or anything like that. I'm not asking you to bring your own gloves or anything like that. But if the site does require an N95, usually I will give you a good enough heads up or be able to get you an N95 mask. You are not there just to do skills. You are not there just to do assessments. You are there to be a student and to learn, to try and pick up as much knowledge as possible. Some of the best things that I learned during paramedic school wasn't from PowerPoints, it wasn't from lectures. It was from the things my preceptors taught me during paramedic school. The things I was able to ask physicians, the things they were able to show me, show me 4 leads, show me 12 leads. That's pretty important stuff in coordination with the lectures that you're receiving. So we try to schedule some of that stuff around lecture time, so it kind of makes a little bit more sense. Again, try to introduce yourself to every patient as possible that you are a paramedic student. I've never ran into a patient that completely freaked out Even my very first patient I started an IV on, I told him I was a student. It's kind of awkward at first telling him that, but it's really not that big a deal. Please try not to eat in any patient areas. There should be some sort of a break room or cafeteria or something that you can take your lunch break or whatever during your clinical time. Just kind of ask the staff at that point. We don't accept gifts. We don't accept any tips or anything like that from the families. And again, do not offer medical advice. You are a student, not a practitioner at this point. If for some reason there is any piece of equipment that would need changed, such as an IV pump is alarming, or a blood pressure cuff, I'm not worried about blood pressure cuff, you guys can do that. Something that's not in your scope of practice as an EMT, make sure that your preceptor knows about it, or that your preceptor is okay with you doing what you're doing at that time. You should not have any visitors at your clinical or field rotation. Maybe if it's your own site or something like that, that could be a different story. But if you're going to somewhere that is not your place of employment, I would highly recommend not having people come up and visit with you the whole time. If for some reason, again, you become ill during a clinical, or there's been some sort of exposure or whatever it might be, please, please, please let me know as soon as possible, whether it be through Teams phone call, a Teams message, or calling that clinical phone number, or texting it. That way I can kind of start getting forms filled out and get the ball rolling on making sure that you're taken care of as a student. Obviously, just much like a place of employment, we do not condone alcohol or any sort of chemical or drug use during paramedic school at all. When you're anything with Mercy College, we obviously, anytime you're at a clinical site, I'm not saying on your off time, if you want to have a drink, I'm not saying that. Your personal life is your personal life. Just when you're at your clinical and field time. If for some reason we do suspect it, we can ask that a student be drug tested at that time, just to make sure that there are no substances or chemicals that you might be under the influence of. If you are taking any sort of prescribed medication, that's fine, just as long as it won't impair you to act as a student. Or if there's some weird circumstance, just make sure you let me know, or let your preceptor know at the time when you get there, that it may cause, dizziness, or if you're on a new prescription or something like that. We used to prohibit telephone usage, but now, a lot of people document stuff on telephones. I'm not going to say your phone has to be kept on silent. If there's a family emergency or something like that, just keep your phone on vibrate. You're going to look at your phone. I looked at my phone. Just try not to make phone calls unless you truly need to. I get it. You're still going to text. I'm not going to say don't do it, because it's going to happen no matter what, but just try to be professional about it. You are absolutely allowed breaks. Obviously during your field time, there's not really any assigned break. You're eating when you can, or whatever that might be. During your clinicals, you can get an hour for lunch or whatever you need to at that point. Just try to adhere to whatever time. I try to say an hour is a pretty good amount of time to be able to take a lunch break. I don't mandate that you take that hour off your clinical time or anything like that. My opinion, you're still there doing clinical time. You're just on a break. You're not permitted to bring any weapons with you. Now, what I mean by weapon is firearms or knives that aren't used for a professional experience. So like if you have shears or something, or maybe a knife that you carry at your fire department or something like that, I'm not worried about that. But I would not bring that into any clinical setting. Not because I don't trust you with it, but I don't trust the psych patient that could potentially get their hands on it. So be very careful about what you bring in with you. And it's going to be the same for jewelry as well. Disciplinary action. If for some reason disciplinary action is warranted, there's a number of reasons, including the ones that are listed here in the handbook. Unprofessional behavior, violation of any of these codes of conduct, your dress code. It could be that, they think you're under the influence of alcohol, or you stink like cigarette smoke, or whatever it might be. Or again, you just are not a good student. That it could potentially result in a disciplinary action. Generally, your first occurrence is a verbal warning, depending on how severe the occurrence is. Second occurrence is a written warning, just much like a place of employment. Third occurrence is taken kind of above us, and we let the college determine what should happen after the third occurrence, which could include dismissal from the program, depending on how severe it is. A good example of an occurrence, again, is we had a student that said that they were at a clinical site when they weren't, and this was towards the end of their paramedic school. One of us happened to go and check, because I'll pop into hospitals every now and then. I don't care where you're at in the state. I'm required to every now and then go and visit clinical sites. And the student wasn't there. So nothing was said. We checked the documentation later on, and it said the student was there and documented 4 patients. That student was removed from the program and ultimately ended up losing their EMT license. Or EMT certification. So just be mindful of what you're doing, because you can get caught. If there is a serious violation, those are taken case by case. So you're enrolled in paramedic school, technically with the Iowa Department of Public Health, you're listed as an EMS student. If you decide to go on a call as an EMT and perform skills, that is way outside my realm with the college. The Iowa Department of Public Health then has to get involved at that point, and that is considered a serious violation. All right, your student and preceptor evaluations. I'm not gonna go over documentation till the end, but for every shift, and I don't care if it's just you hopping along for one call, whatever it might be, you have to have 2 different evaluations filled out. They are the student and preceptor evaluations. Now, I will show you those here shortly, but they are available on Canvas right under this handbook link. I would suggest bringing copies with you. There is a eval you're going to fill out on your preceptor and an eval you're going to let them fill out on you. They should give those back to you, but if they don't and they want to mail them to us or email them to us or whatever it is, that's perfectly fine. Some people will do that. It doesn't mean you're in trouble for anything. It's just that's how some people went through paramedic school, is that they didn't give those back. Not a big deal, but you need to have one attached to every shift. So the easiest way to do it is literally have the evaluation filled out. You can either scan it into your shift and attach it as a document, or you can take a picture of it and attach it as a document. I have people that just take a picture of it with their phone and attach it up that way because it's easier, or take a picture of it with their iPad or the computer, whatever it might be. Just make sure it's legible and that I can read it. There are online evaluations on Platinum. If you want to use those instead, you're more than welcome to. Just again, pick one or the other, or you might do one electronic eval and decide you don't like it and go to the paper ones at that point. We recommend that any information is put in within 72 hours of the start of the shift. So if I go to a shift on December 2nd, I should have it documented by December 5th. I get it. You guys have jobs, you guys paramedic schools a lot, but 3 days is plenty of time to get everything documented. If not, I can technically set it to where it locks you out of that shift and you can no longer document anything at that point. And anything after 3 days, you're going to start to forget information, especially if maybe you ran a lot of calls or you had a lot of patients that day. I do not require on clinical shifts that you put a whole lot of information, just a short little paragraph about the patient. Maybe you're in the ER, 37-year-old male came in with trouble breathing, was administered a albuterol treatment. Okay, that's probably good enough for that patient. Maybe you throw in their history, things that are pertinent. Now, when it comes to writing a narrative for a field report, I expect a long narrative. It doesn't have to be massively long, but I expect a lot more information, just as you would if you were out in the field. And I'll show you guys that here shortly as well. What I did honestly during paramedic school was I had a template in Word, and I would just change it for each patient, so that way I could just copy and paste it. All right, before we hop into this, let's take like a 10-minute break. We'll say 6:45. We'll come back here. We're gonna go through the hours because this is gonna take the most amount of time. And then we're gonna jump into some of the other clinical sites, and then we'll hop on the Platinum and play around with that for a little bit. So about 6:45, and we'll come back here and then jump into our hours.
Hey, Rudy, I had a question about the appearance or what about hats? Because I typically wear a ball cap, but a solid colored one work, or is that just
No,
a
yeah,
no?
I don't see, I mean, I'm sure the handbook will say no, but I mean, I'm fine with that. Unless
Okay,
specifically the clinical site you're at says something about it. I don't think there's an
okay.
issue. All right, I got 6:45, so we're gonna keep on trucking. Um, so one of the questions everybody always asks is hours. How many hours are required? Now, remember, this is minimum hours. This is the minimum that is expected. Now, you might have to exceed those hours because along with hours, you have to get a certain number of competencies, such as patient assessments, such as intubations, IVs. So if you have all your hours done, but your competencies aren't complete, you might end up having to go back for more time just till those competencies are completed. Again, these ones are clinical hour requirements because anything that ends in 3 is a clinical. So for first semester, we say 96 hours of clinical time. Second semester, 96, third semester, 96. It's pretty easy to remember 96 across the board. And that's for the whole course. Now, I get it. There's only a month left of first semester. You might not be able to get all your clinical and field hours in. What I'm saying is by the end of the program, then your hours should equal what's required here between all 3. I completely understand. You'll have jobs. You have a personal life as well. I understand you might not be able to get all these all completed in a month, so don't freak out. Now, competencies for first semester. What's required is 25. Now, again, if I start five IVs in the ER on one day, that's 5 competencies. If I give a medication, that's a competency. A competency is an assessment, is a skill, is defined in our handbook as, you have to do an OB assessment. You have to do so many OB assessments. You have to do so many respiratory assessments. You have to do so many adult assessments. So if I have an adult having a respiratory problem, that right there is two competencies, because adult and respiratory. Now, if I start an IV and give a med, that just became 4 competencies on one patient. So it might look like a lot. It's really not. I mean, on one patient, you can get 7 or 8 competencies on one patient alone. The average number of competencies, this is 165 for the whole program. I think last year, the average number of competencies patients or students were getting was almost 1,000 total. So trust me, you will get this easy. So where you're expected to be able to perform time during first semester, obviously the adult emergency department, pediatric emergency department, the OR, phase 2 recovery, which is like the recovery room from the OR. Respiratory, we're not mandating this year because the one in Mercy here in Des Moines isn't requiring it or isn't taking students, so I can't require it for anybody. Same day surgery, also known as ambulatory surgery. Peds floor. So like if your facility has a pediatrics long-term stay or something like that, that's what that is, just general peds where they are observing them overnight. Trauma ICU or neurotrauma ICU, and then cardiac med ICU. So those are the ones available for first semester. Second semester and third semester includes all the ones above, and then adds in some like cath lab, cardiac surgery, the PICU. NICU is not accepting students, so that's not going to be anything either. What else on here? We don't send anybody to long-term care like a nursing home. I think in EMS we spend enough time in those. And then cath lab recovery. So there's only a couple from first semester that you have to complete in second and three, but a majority of your time will be spent up in the ER. And remember, you only have to do really one shift per unit. So let's just say labor and delivery. You really only have to go there for one shift. You don't have to do multiple shifts at these. Now, where it might get tricky is like the OR or ambulatory surgery. You're required to get 10 live intubations throughout the whole program. So you might end up having to go there more than once, because I highly doubt you can get 10 intubations in one shift. But majority of the skills you're going to be performing, you can get in the ED. And that's really where you're going to do a lot of your learning. Now, your ICUs are great for drips. They're great for patient assessments. They're great to really see sick people. If you are coming to a hospital in Des Moines, anything with an asterisk next to it means those are only performed Monday through Friday. Now, if you're not in Des Moines and your facility has those during the weekend, any of those on the weekend, you can act as a student. I'm fine with that. That's not a me thing. That was a Mercy and Des Moines thing. Before I move on to field, questions about clinical stuff. Okay, and you can ask me questions throughout, like when you start too. You don't have to. You're gonna have questions after tonight, I guarantee it. Field hour requirements. Remember, field is anything that ends in a 4. So 114, 134, 164. Now, first semester, it is required that you get 48 hours. So if you're doing 12-hour shifts, four shifts in first semester. Again, in conjunction with your clinical hours, if you can't get that in first semester, not a huge deal. It will just need to be done by the end of the program. But you need to be working towards it. You can't just complete nothing and then expect to just make it all up. You have to be working towards it somehow. Second semester and third semester are both going to be 96 hours. Now, most places do 12-hour shifts. If there's a site that you know of that will let you do a 24-hour shift, I'm fine with that. It does not bother me at all. If you want to do them at your own place, we used to not allow that. You can only do 40%. I don't care if you do them with your own service. It doesn't bother me at all. To be considered an ALS call, the patient has to have at least 2 ALS skills. So like an IV and patients on the monitor, that's 2 skills. IV and a med, innovation and end title. Now, saline doesn't count as a med and oxygen doesn't count as a med. So any other med besides those 2 can count as a medication. So if you give an albuterol treatment and put the patient on a monitor, that's technically an ALS call at that point. So what's the word I'm looking for? Be creative in your documentation. I'm not saying lie, but a lot of times we put patients on cardiac monitors and don't even think to document it, or we, think through your calls. What did I do that's considered an ALS skill? Because that will make it an ALS run. And that's what we're ultimately here for. Minimum competencies. First semester, you only have to get 10. So that could be 10 IVs, it could be 10 meds, 10 assessments, just 10 skills on a patient somehow, whether it be an assessment or a skill in itself. Second and third semesters are both 50. this is the easiest thing that you guys will get. Those are just random competencies. It's not saying a set number of this or set number of this. You just have to get those in total for those semesters. During the period of your rad time, we have what's called capstones. Capstones are, how do I say this? 20 final ALS calls. So remember, it has to have 2 ALS skills performed. Now, to get those 20, you have to have prior to that 30 calls, and 20 of those have to be ALS. So you will need 28 or 40 ALS calls total, and you can have 10 that are BLS. That's only 50 calls total in a year. That is nothing. It's super easy to get. But to act as the team lead, you must accompany the patient to the hospital or the team member. So you can't just show up, do skills. You have to be there for the entire length of the call. Breaking down our competencies. Actually, back up. Team leads aren't usually done till 3rd semester. So everything up until that point, you're selecting team member. So 3rd semester, you can select team lead because that's where you're gonna get your final 20. So up until that point, you're a member. Once you hit 3rd semester or late 2nd semester, you're a team lead. To be a lead, you have to go through ACLS and PALS first. And we do that like the first week or last week in 2nd or 3rd semester. So to get those final 20 calls, you have to have ACLS and PALS. Competencies. This is our age. So you need 30 pediatric assessments. Not that big a deal. You're going to go to the PEDS ER, you can go to the OB, you're going to go to pediatric ICU, the PEDS floor. That's very easy to get. In one shift, you could get 10 pediatric assessments. 60 adults. Again, not that hard when you're seeing 8 patients in the ER a day, roughly. If you're at Mercy in Des Moines, you're seeing way more than 8. Elderly people, 18. A lot of our patients are elderly. You will need to do 27 trauma assessments, 18 psych, 18 cardiac complaints, 3 cardiac arrest, but you'll see that these say lab 2 to 1. So your cardiac arrest can be simulated in lab or scenarios. Anything that says yes next to it means that it can be simulated. So like your OB delivery, simulated. Your distressed neonate, simulated. You need 12 respiratory complaints, so breathing problems, 12 neurologic complaints. That could be an altered mental status. That could be a low blood sugar. Now, again, be creative, because if I have a patient coming in with a stub toe, what does that technically classify as far as the competencies you see there? Yeah, it's a trauma assessment. That's anything that's not medical. Somebody stubs their toe, somebody slams their finger in a door, somebody, falls. A fall is a trauma assessment. It's once you think about how many trauma assessments do we actually do, it's really not that big a deal. Once you put these into Platinum as the chief complaint, trauma, or you'll select trauma as a pathology, it automatically fills in and tells you how many you have left. It's really not that hard. Can you get more than one assessment on a patient? Heck yes, you can. If I had somebody that was having trouble breathing and went to sit down and they fell, okay, so I just got a respiratory assessment and a trauma assessment off one patient. You can get multiple assessments on one patient. It's not just, one assessment per patient.
I have a question.
Yeah.
When you're doing simple trauma assessments or whatever, just like that,
Mhm.
that's BLS.
Yeah. Yep. Mm-hmm.
But we
These-
can count that as a patient contact.
Oh yeah, yeah. Because your assessment in itself doesn't outline ALS assessment versus BLS assessment. The only thing that it's outlining ALS versus BLS is your skills. Because much of our trauma assessments are BLS. I mean, if you think of a trauma assessment, I'm going down and it doesn't have to be a head to toe assessment. Somebody comes in with a broken finger, I'm not checking to see if their C-spine needs maintained, right? Somebody comes in with a broken finger, there's really nothing I'm doing ALS besides maybe providing pain control. That's when it falls into the ALS category, is when I start to do the ALS skill. So, and I'll show you how you classify that and kind of how it's broke down when we get into platinum. But like psych patients, those aren't ALS. So yeah, no, that it's not going to break it down ALS versus BLS. As long as you're getting those pathologies or those competencies right there, it doesn't matter if it's an ALS or BLS. Did that kind of answer your question? Sorry.
Yep, appreciate it.
Yep. These are the skills. So 25 IVs, 10 medications, 10 live intubations, 10 or 2 IV infusions, so IV drips. But guess what? Those can be simulated. IM injections, IO access simulated, positive pressure ventilation 10. So guess what? You need 10 live intubations and you need 10 ventilations. So for each intubation you get, you should probably be bagging the patient because that'll count as 2 skills. Endotracheal suctionings can be simulated since you're not going to respiratory. Foreign body airway removal simulated. Crikes simulated. Supraglottic airways, you need 10. I'm guessing you've probably done 4 or 5 already in lab. So the stuff in lab counts towards this. Like you guys have probably already started to do these and just not realized it. Needle decompressions, 2 simulated. Cardioversions, 2 simulated. Defibrillations, 2 simulated. All these can be technically simulated. The only ones that you have to do in person are the ones that say no next to them. So I highly doubt you're gonna be able to cardiovert somebody during paramedic school. It says you need 2 of them. If you can't get them, then we just simulate them during scenarios. Not a big deal. So when you look at that, really the skills aren't that bad. It's the assessments that you have to do more of than skills. Now, but again, this is just what's required. Are you going to probably go above and beyond this? Yeah, I would guarantee you're going to. But these are just what we require. And actually not even us, it's the national standard now that changed this year.
Rudy, it says lab 2 to 1. Does that mean that you have, for the simulated ones, you have to do like twice as many or something?
Yeah, so like if let's pick one here. So for establishing IO access, it says you have to do 2. Well, so what that means is that in the lab during paramedic school, you have to do 4, and then that'll suffice the 2. But let me double check because I think that changed. I think it's 1 to 1 now. Actually, I know it's 1 to 1. So yeah, they are 1 to 1, not 2 to 1. So you would literally only have to do 2 fake IOs and that would count. But again, if you get to do them in the field, absolutely document them. If you get to do them in the clinical, absolutely document them. But this is just saying in the event that you guys don't during paramedic school, we can simulate those in a lab or scenario. That makes sense?
Yep.
You're going to see what's called P1. That's just what we call a red card. That is the introductory phase of paramedic school. You're going to see the skills that can be performed. So things that we've all gone over, initiation of IV. We might not have spent a whole lot of time on drawing blood or at all because the hospitals you're going to be at will show you their way of doing it because every hospital is going to be different. Intubation, supraglottic airways, calculation of IV fluids or IV, fluid over time, medication administrations, calculation of medication dosage. So if I have 4 milligrams of Zofran, I want to give 2 milligrams, that sort of thing. Performing a patient assessment and then documentation of your clinical experience. That's all introductory. P2 level will be second semester. Now, what that introduces is management of medical and trauma emergencies. So second semester is all about diseases and emergencies. So once we get into second semester, start covering those, that's where you'll be able to look at 4 leads. You'll be able to look at 12 leads. You'll be able to essentially move more towards running the call instead of just being one of the members. Now, I don't expect, when we call it a team lead, I don't expect you to show up to a department or to an EMS service and tell them how to run their call. I just expect you to be able to work with the team lead. I don't expect you to sit there and be like, you need to do this, you need to do this. That's unrealistic. I just expect you to be more involved. And then correct documentation of field patients, correct interpretation of EKGs, So really the big one is your assessment in cardiology with your second semester. Maybe we get into suctioning at that point, but again, that's going to be simulated. Your third semester is really where you act as the team lead. And that's where I was saying third semester is where we start documenting everything as team lead. Up until that point, we're documenting as a team member. Third semester, you get what's called a green card. Second semester was a yellow, first semester is red, second semester is yellow, third semester is green, kind of like a stoplight. Stop, stop, slow down, go. And then if you want to read about each department, so the ICUs, if you want to read about what happens in the cath lab, if you want to read what happens in the ED, this is just the objectives and what's expected of you as a student in each one of those departments. I'm not going to go through each one of those departments. If you want to read it sometime, you're more than welcome to. All right, in regards to handbook, I know it's a lot of information. What questions can I answer about this before we move on to like platinum? And again, if you don't have a question tonight, but then like 20 minutes from now, or 20 minutes from when we end, you have a question, shoot me a message. I apologize, I haven't been very responsive the last couple of weeks. I had something personal, family come up, and so I hadn't really been at work. I took some time off, but I am back now. All right, if you guys don't have any questions, I will get platinum pulled up and we'll kind of go through that a little bit. And I'm going to log in as a student so I can show you guys really what I'm expecting in documentation. I created fake ships for myself, so that's what you'll see. So from my home screen as a student, this obviously are things that if you need to document something or if you need to finish documenting something, this will tell you things that you need to address. Or if something was returned to you, returned opportunity needs to be corrected. I returned something to myself as an instructor to my student account that I just rejected because I didn't like it. But if you want to look at what we call opportunities, which opportunities are your clinical and field shifts, you could literally click your opportunities, and those are the ones that are scheduled to you. Now, if you want to look at available opportunities, and this is mainly just for Des Moines, if I click available, it will show me, if I select, let's say hospital time. So I'm gonna click clinical. It's gonna show me anything that I can sign up for. And again, these are 2 weeks out. So that's why the first date is 11/22. But if I wanted to sign up for something in Des Moines, I would literally just click sign up and that's it. So this one here, if I click sign up, it's going to ask me, there's 2 slots remaining. Am I sure that I want to take one of the slots? And then I would hit sign up and then that would approve my shift. ER is the only ones that I have to manually approve. I just have to make sure that there's no other students like EMT students or advanced EMT students in the ER that day. And that you guys, that the shift is free. I haven't ran into any issues yet, but I just like to double check that. Any other sites such as your ICUs or anything like that will automatically accept you into that. Now, if you need to cancel that, again, you can go back to that My Opportunities, which I'll go to, and I can click request to cancel, and that will send me a message, and then I can remove it for you. So again, I gave myself 2 shifts. One is at the hospital, one is a field shift. So we're going to start with the hospital one. So this is in my opportunities. You have different tabs here: upcoming, ready to document, returned, submitted. So ready to document means it's today. I'm at my clinical shift. I need to document some stuff about a patient. So let's go to the ER. I'm going to begin documentation. The thing it's first going to bring you to is like a basic overview of the site itself, the time that you're supposed to be there, how long it lasts for. If I keep scrolling down, I can see the history of like maybe if I added a patient, if I open the shift, anything like that, it'll give me an audit trail. Now, I don't have any patients documented in here, so we're going to go ahead and document a patient. Add patient. Obviously, if you're at a clinical site, they should be live. So live patient, contact type. If I were you, I would be selecting ALS almost on every patient because that's the level you're training to. Somebody just give me a random age and chief complaint.
64-year-old chest pain.
Okay. So chief complaint. Chest pain. Gender, was it a male or female?
Female.
Patient's age, 64. I don't expect you to fill out months, days, or hours. The only time you would do that is if it's like a newborn. So 64-year-old adult male came into the ER with chest pain by ambulance. 12 lead showed, you could be simple, showed nothing. Patient given aspirin, nitro, and admitted for monitoring. I expect you to put all the pertinent information. If you started an IV, then I want you to put 20 gauge IV placed in patient's left AC. You don't have to put a ton of stuff. It's not like writing a full narrative. It's very simple. What they came in for, what's going on with them, what you did for them. That's all I want. So again, overall exposure, competency, no, formative. Now that's going to allow me to select team member. Team member and team lead does not matter, honestly, for clinical sites. That's only for field. Add pathology. So this is not a dysrhythmia. And when we get into second semester, I'll explain dysrhythmias. Cardiac pathology or complaint. Yeah, it's chest pain. So we're guessing cardiac issue. So for team member, I'm going to hit successful. For cardiac complaint, I'm going to hit successful. Let's say we started that 20 gauge IV. So skill established. Oh God. IV access successful. 12 lead obtained successful. We gave him medication. Let's just say IV bolus medication successful. If it is not on here as a skill, then it is not required for you to fill out. So like oral medication isn't on here. That's because it's not something that is mandated. Remember, you only need to do 10 IV medications. So oral medication is not going to be on here. So I have this all filled out the way I want it. Literally all you do is hit save and that patient's done. That's all you have to do. It gives you a brief overview of the patient and says what everything you did for them. Now that stuff will automatically default into my progress report. It's an adult, not a geriatric, because they were 64, not 65. It will count as a team member. It counts as one of your cardiac pathology complaints. Literally, let's see, we've got 1, 2, 3, 4. I've got 6 competencies on this one patient. It lists how many you have. So I needed 25 total for first semester for clinical. I just got 6 on one patient. That's what I was saying, how easy it can be. I don't expect a whole lot of information. Forms, unless you want to do the online clinical preceptor form, that's fine, the evaluation on them. I'd prefer if you did the paper ones and uploaded them here as a document. Again, you can take a picture of it and just upload it straight to here. Now, when I go to submit, it's going to give me a rundown. It's going to tell me, okay, 12 lead obtained. I'm good. I got 100% of that. I have to give 10 meds. Okay. This counts as one of them. It will count as one of them because I have to approve it as the instructor. Adult, I need 30. Formative, this will count as 1. 12 cardiac, 25 IV. So it gives you a breakdown of what you did. Now, it won't let me hit submit because this evaluation cannot be submitted. You must select a preceptor. Okay. So to select a preceptor, go back into information and it's gonna say select a preceptor to assign. Now, there will be some people in here already. But if they're not, you can just hit new. Let's say your nurse was Jane Doe. You do not need their email address. I hit save. It says they're a preceptor at Mercy One Hospital. All I do from there is go through what I like to save, yes, and then I submit it. That's all there is to it. You can add as many patients as you want to this. So if I was to add, a 27-year-old overdose. I don't even know if overdose is on here. Ingestions, poisons, overdose. Male, 27-year-old adult male, brought in by EMS for opioid overdose. Successful pathology would be other medical conditions or complaints. Successful. We didn't start the IV or rescue did that already, but we gave the Narcan, so that's successful. And then save. Does that seem easy enough, or I guess, is there any questions over that, or can I answer anything for you guys?
If you have, say you're in the ER, there's a good chance you can have more than one nurse as a preceptor, right?
Yep.
But is it one
What I-
preceptor per site, kind of?
Not really. So like, if
meant
let's just say you're in the ER and you're there during shift change, so you technically have two preceptors. I would put the one that was there when you're leaving, because
Okay.
she's the one that's going to sign your documents. If something odd happened, you could put it in the notes, like needle exposure or needle stick or something like that. You could by all means put that in there. But there, as far as documentation with patients, there's nothing more you should have to do. And again, this stuff will auto populate into your progress report. That makes sense? For clinical, at least.
Yep.
Okay. All right, so I'm gonna go back to my opportunities and we're gonna select that field one. Because this is a little bit different. Not a whole lot, but this one for Waukee Fire Department. Begin documentation. The layout's the same. It's gonna give me my information. I could select my preceptor now if I wanted to. I'm just gonna put myself. Now you'll notice it saves the preceptors you put in here. So I put Jane Doe, it's gonna save her as a preceptor and tell me where they were a preceptor at. But I'm the preceptor, patients. Somebody give me a random patient and talk me through your treatment for them. I don't care what it is. I might have to write it down before I document it, but. Anybody? All right. Let's just say 37-year-old male with abdominal pain. So abdominal pain, male, ALS call, 37 years old. For this, I just want a brief overview. 37-year-old adult male called 911 for abdominal pain. This is basically like dispatch information that I want in here. Again, team leads are gonna be more towards third semester. So formative, team member, successful. Pathology, let's see, is abdominal on here? No. So that's going to fall under medical, neurologic pathologies or complaints. Okay, successful. Let's say we started an IV and gave fentanyl. But when we give fentanyl, we also have to put them on a cardiac monitor. So we did a 4-lead, successful. We administered an IV medication, successful. And we started that IV, successful. Okay, now for this patient, you're going to go ahead and hit, oh, since it's a field shift, you do have to hit EMS patient care report. And then successful on that one too. Now what that does is it opens up another window under forms. So I'm going to save this. It adds all my patient information. Now, if I look to the left here, it says forms. So if I click that, it will pull up EMS patient care report. Fill out new attempt. Okay, I don't expect an incident run number. I don't expect any of this stuff. Patient section chief complaint. We'll just put 37-year-old adult male, abdominal pain. If I could spell abdominal right. This was an ALS call. Did you transport the patient? Treated and transported. There was only one patient at scene, not a mass casualty. They called 911. We transported. Some of this stuff is non-pertinent. So 37, what medications is the patient on? Let's say they're on nitro. No allergies, pertinent history, none. Was there a potential injury? No, patient didn't fall, nothing. But if there was, I could select what type of injury and what, like if it was a fall or whatever it might be. Chief complaint organ system. We're going to go with GI because it's abdominal pain. Cardiac arrest, no. Use of safety equipment, that'd be like a car accident, no. And some of this stuff I will edit for you guys so that's not so much in here. But like airbag deployed, okay, if it was a car accident, that's pertinent. Response mode, lights and sirens, transport mode, still the same. I don't expect times, so I'll delete those out of there. I don't expect trauma triage. Symptoms. Let's see, pain, present. Okay, provider impression, abdominal pain. Treatment. 50 micrograms of fentanyl given. Procedures, 20 gauge IV left AC. Put the patient's vital signs in, what hospital you went to, and then just write a short and sweet. 37-year-old male called 911 for abdominal pain. You don't have to put anything that's already in there. Patient administered fentanyl and transported to Mercy. Everything else besides that I am seeing in this report. So you don't have to go really in depth. Everything else I'm reading on this. Once that's done, save it. Okay, so that one attempt is done for that patient. There will be an attempt for every patient. So if I go in here and add another patient, I've never tried this. Let's just try saving that. Wait, I've got to add my EMS care report. Successful, save. Yeah, so now I need to add another report. I would fill out another attempt for that new patient. Same thing. And again, I'm going to delete a lot of this stuff. So when you guys start, a lot of this stuff won't be in here. It'll be very basic information you have to put in here. You won't have times, you won't have, transport, non-transport. I just expect that it's a transport at that point. You won't have a lot of this information. It'll be kind of short and sweet. Put as much information as you want in the narrative. I'd prefer if you did a really in-depth narrative, but I'm not gonna require it since I'm requiring a lot of this other stuff. But I would put pertinent information in this between the first summary and then this narrative. You need to make sure that you're summing up the whole call. Nothing in there is mandated, so you can hit save even though you haven't filled it out. I would upload my documents just like normal, which is my evaluations. Once that's done, I would go into submit. It'll give me a summary of all the things I did, and then I would submit my documentation. Does that make sense?
Question.
Yeah.
Do you have to document unsuccessful skills?
I'd like to see it, but to be honest, I mean, I did, and I do know students that did. So like say you try to start 2 IVs, let's go back to one of our patients. So I have 1 successful IV here, but say I'm like, you know what? Establish IV access, this one was attempted. That shows me as an instructor that you're being truthful. I hate to be that way, but it is showing that you attempted one and then landed the second one. So is it mandated? No, but it does show me that you're actually documenting more than you need to. Okay, if there's no questions on that, I'm going to show you guys how to document scenarios or how to create it. The documentation is going to be the same, but you guys can't create your own field opportunities or clinical opportunities. I have to create those. The only ones you can create under my opportunities, if in the upper right-hand corner you see create opportunity, the only ones you can create are simulations or scenarios. So you guys in Clinton, my site would be Clinton Fire. The time that it's scheduled from, so it'd be during lab time, except we're gonna get out of labs. Labs is for skills, simulations is for when we start doing scenarios. I'll just select myself as the preceptor, submit. Now, once I do that, everything else here looks familiar. I would just add my patient information as normal and then submit it. You don't have to put evaluations for simulations or scenarios. What questions can I answer as far as that goes? And again, I'm going to expect a lot of questions once we really get into it. So don't freak out if you're like, God, I don't remember how to do this. You can either look back on the video, or honestly, you can schedule a time and maybe we could go back over Zoom if you have a certain question on something and I can go through it with you. This is my first year using Platinum. So if you go to document something and you're like, God, that isn't even there for me, just let me know. And that gives me a heads up and I can look into it for you. And I can try to get it fixed at that point. I'm going to jump back to Canvas real quick. Back under our EMS 113 and 114. If I go to either one and scroll down, again, there's my handbook, and then here's my student evaluation and my preceptor evaluation. So you guys can print those off, have as many copies as you want. This is what the preceptor will fill out on you, and they will sign it. And then the other one is the one you would fill out on the preceptor. And again, have them fill those out and then just take pictures of them and upload them as a document to your shift. But again, those can be found under EMS 113 or 114, right on the homepage.
Did you say anything about the field request form? Is that something we need to use?
I did not. I'm gonna actually email that to you guys. For some reason
It shows up in here.
Does it show up?
It's on the field
Okay.
one. So yeah.
I'm actually updating the form to include more sites.
Okay.
But if you need to request field time, because this is an old form, it looks identical, except I added more sites. This is not all the sites we have. We have like over 200-300 sites. So when you see this, this is just ones that are frequented by students. That's not all we have. Also, these hours aren't correct because we moved it down to 96. But this is where you would fill out the dates that are requested and what location. I will ask that, again, I get a 2-week heads up when you submit these to me. You can print them off and then just email them to me, or you can honestly just email me your request. Hey, on this date, can I ride with such and such service? On this date, can I ride with such and such service? I'm fine with that. But also give me a backup service, because if the first one is full or is not taking a student that day, I have another one to turn to. So you can either print this out, fill it out, or you can just send it to me in an email as far as your request goes. But again, I need a 2-week heads up. A lot of people don't use this form, that they just send me an email, but you can absolutely use this form. And I'm hoping by the end of the week to put an updated list on our field sites. It literally updates every week. So I have to keep adding to it, but should have something up indicating what sites we have field contracts for. And again, if there's a site we don't have a contract for, they're really easy for me to set up. It's not a huge deal. I just need contact information and where the site is. Okay, questions. This is the time for questions. Crickets, none. And again, you can always ask me questions later. I'm not too concerned about it. Now, those of you in Mason City or those of you in Clinton, your requirements are the exact same as everybody in Des Moines. So don't feel like yours is any different. It's documented the exact same. Just where you do your clinicals and your ride time is going to be different. Obviously, just based off geographical location. You can still view. I want you to document the exact same way. None of that changes. You're held to the same standard as everybody else. Now, it's you just for clinical sites, especially like Mercy North, or I can't think of what's near Clinton as far as clinical sites. What's the one right there in Clinton, or right near Clinton?
Mercy North.
Mercy near Clinton?
Yeah.
Oh, okay. Yeah, so then it's easy enough for me to, as long as it's a Mercy affiliate, it's pretty easy for me to get in contact with them. Now, again, if there's a clinical site you want to do time at, and you're like, hey, I know somebody here, they can help me get into this site, I'm fine with that. Just as long as I get contact information, I can get it set up with them. Over the next couple of weeks, the next 2 weeks, we're doing anatomy and physiology. We've got like 200 something slides to get through in 2 weeks. That's pretty damn easy. And then the following 2 weeks, we're going to do, I think, pathophys we can really do in one day, one night, because it's like 100 slides. And then our last day is, I'm going to give you guys time for your final exam, or we're going to cover pathophys in 2 weeks, and you'll have a week to take your exam. So either or, it's fine. We're going to get it worked out. I did move a lot of stuff out of the PowerPoint from anatomy and physiology because they tried to dive into medical emergencies, and that's really what we cover next semester. So I moved those slides to the corresponding chapters. It doesn't make sense for me to go over endocrine emergencies when that's literally a chapter we cover next semester. The first 60 slides, I'll be honest, with anatomy and physiology are horrible. They're the stuff you're going to want to beat your head in with because it covers cells and cellular activity and fluid shifts. I will be honest, I was even looking through it like, I don't even remember learning any of this stuff. What that tells you is that it's not 100% something you need to memorize. I don't expect you guys to memorize that stuff. When we get into skeletons, like our skeletal system, that's the point I would start paying attention, because that should be the point right after the cells, where I would start maybe perking up a little bit. When we're talking about cells and the nucleus and organelles and how the body transport these, like I'll specifically say, hey, pay attention to this. And I try to do that for you guys, just to honestly be kind of realistic, instead of feeding you a bunch of stuff you really don't need to know. I don't want to cram your heads any more full than it really needs to be. All right, any questions at all over anything? No, nothing, zero, zip, nada. As always, you guys can get a hold of me, shoot me an email. I see that I've gotten 4 emails just sitting here in class. Might be from some of you, I don't know. You can always send me a message on Teams. If it is something pertinent, such as calling into a clinical shift, field shift, or anything like that, you can by all means contact me through that clinical phone. If I don't answer, leave me a voicemail or text it. Because again, I do lecture a lot outside of paramedic school at Mercy as well, which could be the case. I'm in a class. If you are signed up and you're checked off on Castle Branch, especially if you're off-site, we'll be getting your red cards to you. That doesn't mean you can't start clinical and field as long as your Castle Branch is checked off. If you're not sure if you're checked off, shoot me a email and I will check it when I get in the office tomorrow morning. And you should be good to go to start signing up for clinical and field shifts at that point. And again, if you have questions about documentation, just let me know. Other than that, if you guys don't have anything for me, get out of here. Have a good rest of your night. And we start A&P next week. So be real excited for it.
Thanks, Rudy.
Have a good night, guys.
Thanks.
Hey, Rudy.
Sorry, I couldn't unmute fast enough. What's up? Somebody have a question for me?
Well, sorry, I muted myself on accident.
No, you're good.
I was just letting you know, so I had some trouble with my Castle Branch at first, like getting into the requirements for the shots and everything. So I am still working through that. I'll get it done next couple weeks.
Okay, yeah, that's dude, no problem. And I get it. Castle Branch is a pain. So if there's anything I can do to help, let me know.
Okay, thank you.
Yep.